So now I turn to Mrs. Françoise Girard. She's the president of the International Women's Health Coalition. A lawyer by training, she's a longtime advocate and expert on women's health, human rights and sexuality, and HIV and AIDS. She's regularly consulted by governments and UN agencies and has been instrumental in ensuring that global frameworks include and further women's rights. Mrs. Girard, you have the floor.
Thank you so much. And I'd like to thank the organizers of this webinar for making my participation possible today. As we heard from the other speakers, the COVID-19 pandemic has upended life as we know it, and it will continue to do so for the foreseeable future. The pandemic has both highlighted and exacerbated existing health, gender, racial, and economic disparities. Now, these are injustices and disparities that have been with us for a long time, as was noted, and as the current actions and protests in solidarity with Black communities and against police violence in those communities are once again making clear. This is not new. And as the virus continues to spread, and it is continuing to spread, the fallout has spanned the globe. The pandemic has revealed the extent to which governments, health systems, and social safety networks were unprepared to respond to the needs of their people worldwide. And this has been especially true, as has been noted, with respect to the health and rights of women and girls. While men appear to be physiologically more susceptible to COVID-19 on every other front, women and girls are bearing the brunt of the pandemic, particularly those from historically marginalized communities, Black women, Indigenous women, LGBTQ+ people, people with disabilities, and others. We at the International Women's Health Coalition work very closely with feminist groups from all over the world, and we heard very early on in the pandemic, directly from our sisters in the movement, what was going on in their country context. Almost from the moment the pandemic hit and lockdowns were imposed, we saw significantly increased rates of domestic violence. Calls to hotlines spiked as women reported being trapped, often with their children, but unable to leave. And with community resources such as sheltered, closed, or repurposed to deal with COVID. In Western Kenya, for example, our partner KMET told us that the local clinic for victims of domestic violence had been, without consultation, turned into a COVID center by the health authorities. They had to push the authorities really hard for the center to reopen for victims of violence. The availability and quality of maternal health care also plummeted around the world, evidence of the low priority this kind of care occupies in the minds of largely male decision makers. In Uganda, for example, feminist groups described how the shutdown of public transit was preventing women from getting to health centers to deliver their child. No one had thought about the fact that for many women, the cost of private transportation would be prohibitive. In New York City, where I live and where I'm speaking from today, several large hospital systems suddenly decided, against New York State and World Health Organization guidelines, that pregnant women could not be accompanied during labor and delivery, not even by their husbands, partner, or a doula. This decision affected Black women and women of color particularly hard, as these women routinely face abuse and neglect during childbirth in US hospitals. And they are the most in need of support and of an advocate at the time of delivery. Women and girls experience also a loss of access to other reproductive health services, such as contraception, as clinics closed and shortages of drugs and equipment became evident. Meanwhile, right-wing lawmakers in Poland, in Brazil, in the United States, and in other countries seized on the pandemic as a pretext to declare abortion and gender-affirming care as non-essential or elective services, in effect banning these critical services during the pandemic. And all of this took place in a context, as has been noted, of school, daycare, and elder care closures, which placed a staggering additional responsibility and burden of care disproportionately on women worldwide. Now, I don't want to suggest that these phenomena are unique to the COVID-19 outbreak. Existing inequalities and policies of discrimination are often exacerbated during crises, with widespread and severe consequences for marginalized women and girls. We saw this, for example, during the 2014 Ebola outbreak in West Africa, when sexual and reproductive health and rights were sidelined during the response, and many women died not of Ebola, but of maternal conditions. We saw this during the 2015-2016 Zika crisis, when Brazil's draconian restrictions on abortion and the low access to contraceptives in the poorest areas of the country severely harmed and endangered poor Black and brown Brazilian women. This ongoing tragedy makes clear the urgent need to reimagine completely our approach to healthcare, and especially sexual and reproductive healthcare. It's well past time for all decision makers, such as yourselves, to adopt and implement policies that will immediately empower women and girls to take greater control of their healthcare and improve access to critical services in the long term. Feminists worldwide sprang into action as soon as COVID emerged. Because of their roots in their communities, they quickly recognized the scope of the crisis, the need for quick action, as well as a clear set of broader demands. In Poland, for example, when the conservative government wasted no time in attacking sexual and reproductive rights, yet again, Polish feminists quickly mobilized against two draconian bills to ban abortion and sexuality education. Now, while this fight is far from over, the feminists of Poland forced the tabling of the bills for the time being. In the process, they showcased the power of feminist organizing and of innovative protest techniques. They blocked the main roundabout in Warsaw with car protests, and they engaged in social media blitzes, which dominated the media space. Similar tactics were used by feminists and other organizers in Brazil, in South Africa, and around the world to stop immediate harm. To articulate the feminist vision for a post-COVID world, a coalition of over 300 organizations, including IWHC, organized online and developed a document entitled The Feminist Response to COVID. It now has its own website, Feminist Response to COVID. I urge you to take a look. It outlines the bold policies we need, and it also documents the efforts of feminists worldwide to hold their own governments accountable. This is complemented by the pre-COVID Feminist Declaration, an agenda for gender justice that was developed by more than 200 organizations worldwide, and which includes detailed policy proposals for a more just and equal world. The policies suggested aren't new, but they're more urgent than ever. The feminist movement has, for a long time, advocated for financing and supporting of quality childcare and elder care. This is especially critical for the domestic workers, women of color, and immigrant women who do this work in often appalling and insecure conditions in many parts of the world, including in the OSCE. We asked for sufficient services and financial support for survivors of gender-based violence as an integral part of the COVID response and of permanent social services, not as an afterthought. We demand that contraceptives and abortion pills be available over the counter, and that countries allow telemedicine to counsel people on contraception and abortion, as well as for other health needs. We demand that healthcare workers, the vast majority of whom are women, be paid equally, that they be free of abuse and harassment at work, that they enjoy decent work conditions, including effective protection against the virus, and that they be promoted to the positions of leadership they so obviously have already earned. We demand an immediate end to police violence and the reallocation of funding from policing to community self-support and investment. Reproductive justice demands that. I want to note in closing that many of these demands of the women's movement are supported by international agreements and guidance on women's rights and sexual and reproductive health and rights, from the Cairo Programme of Action of 1994 to the Beijing Platform for Action of 1995 to the 2015 Sustainable Development Goals and beyond. 2 weeks ago, the World Health Organization issued a fantastic guidance on maintaining health services during COVID. It urges governments to expand access to telemedicine, to declare abortion an essential service, and to ensure that patients' human rights are not undermined by the crisis response. So I urge all of you to heed the call of feminists and other social justice activists in your country. They've done the work. They've outlined the needs, the concerns, the priorities, and the solution. In addressing our current crisis, we must prioritize the rights of women, girls, and marginalized communities. And we must set ourselves on the path to an equal and just society. The COVID crisis has caused and will cause severe pain and loss. But let us work together to ensure it can also be the beginning of a better, fairer, and more peaceful world for all of us. Thank you.
Thank you very much, Mrs. Girard. Thank you very much. I would like also Mrs. Girard, if you have 2 minutes.
Yes, I want to respond to the question by Ms. Sederfeld about what should we invest in to address the situation of women in this crisis, especially on gender-based violence. Obviously, the investment in shelters, hotlines, including text messaging when women can't be seen to make a call during an emergency, needs to happen now, and it needs to be a consistent investment. We can't ramp up those services in the middle of a crisis. We also need to make sure women and their children are given financial support as they exit from the situation of violence, so they don't have to go back where they're going to be at really great risk of being killed. We also obviously need to invest in legal support and especially social protection orders so that women can keep the perpetrators at bay. But I want to speak also to the underlying conditions, which is the gender norms that gender-based violence actually serves to uphold. And investing in immediately in education on gender norms in primary school with boys and girls is critical. If we don't change the way in which boys and girls are socialized around gender norms and the use of violence to enforce gender norms, we're never going to get out of this situation. And finally, as UNFPA has noted, we are facing at least 7 million unwanted pregnancies as the result of the COVID situation and the lockdowns. That's a crisis for many women who then face violence at the hands of their partners because of this unwanted pregnancy. So that's why our call for telemedicine, for contraceptives, and for abortion pills. We should be able to counsel women by phone, counsel women by internet, and mail them the pills so that they're able to take care of themselves. No need for clinic visits. We know that the World Health Organization is clear about that. So let's put that in place now so we don't have to face this again. Thank you.
Thank you very much.